Welcome back. And if you have been listening to this podcast since March of 2025, you have been listening to me talk about the FDI Henry Schein collaboration on integrated health records project. So if you're new to the podcast, what I would do is I would go back to my original interview with Dr. Ryan Hungate with Henry Schein 1. We did an interview in Cologne, Germany, on the consensus statement that was released in March of 2025 with the collaboration between FDI and Henry Schein. And so you can get all up to speed on what I've been talking about with this integrated health records project. And what I've been doing is once I did the interview with Dr. Ryan Hungate with Henry Schein 1, we kind of just previewed what this project was all about. And then what I started doing is individual podcast episodes on the 8 oral health indicators that are slated in this consensus statement. So these are the 8 oral health indicators for integrated records. And so I'm on number 8. So number 8 is imaging and other diagnostic records. And so what we're going to talk about here is probably not a lot of new stuff because I think most of you are using digital imaging. Okay. I probably haven't seen a film x-ray in at least over a year. And I don't think anyone is still dipping film in Developer anymore. Now, if you are still dipping film into Developer, if you still have film x-ray, then you are going to want to move to digital imaging, not just because of this health project, this integrated health records project, but also because it's better for your patients. It's more accessible for your team. The imaging is better. The organization of images is better. I mean, just everything about it is better. I think, one of the funny stories when I was in a practice and my practice, I came from a tech background. I mean, my first introduction into dentistry was working for my Uncle Dave's software company. I was a software support person because he had his own dental software, practice management software. And I also did IT. Like I was 21 years old and I was building computers and I was running cable and, crawling around on floors with screwdrivers, installing networks into dental practices. That was my introduction into dentistry. My first my second dental practice I went to work for on Whidbey Island. That practice, I started working there in 1994. And we were still dipping film x-rays. Like I would help develop x-rays. I got really good at it. Actually, I was really good at developing x-rays. And we didn't upgrade our computer software until 2003. So in 2003, we switched over to a more robust dental software. You might have heard of it. Dentrix. Okay. Well, that was my first introduction into Dentrix was in 2003. At this point, my practice was still full on paper charts. Okay. We did not use computers for anything. We still had a paper appointment book. We had a paper appointment book and we were dipping film x-ray in 2003. Okay. And it wasn't until about 2008 that I finally got my doctor to switch over to digital imaging. Okay. Now, my dental practice, we were paperless before we were chartless. Okay. That was kind of weird, right? How can you be paperless before you're chartless? Well, because I loved technology. I loved dental software. I took my practice paperless with electronic forms. I was one of the first dental practices to use Dentrix questionnaires. We were sending out electronic forms to patients. I was doing all of my billing and everything electronically, everything in the clinical room. All the clinical notes were all electronic. The only thing that my doctor could not give up was film x-ray. And I finally got him to switch over to film x-ray. And the reason he did, not because of me pushing him to do it, but it was from his colleagues, his study groups. My doctor was going through LVI. And so they were finally like, dude, okay, you need to have digital imaging. And so I think it was around 2008 where he actually switched over to digital imaging. And finally he admitted, he said, oh my gosh, why didn't I do this sooner? Well, the imaging is amazing. Me as his treatment coordinator, I needed the x-rays in order to do consultations. I needed the x-rays to send on claims and all of that. And he's like, why didn't I do this sooner? And I'm like, I've been talking to you about this for years. So anyway, it took him a while, but I get it. Digital imaging is a big deal when you're a doctor because you use it for everything. And now we have the ability to not only have digital imaging, but we also have the ability to have AI run through the x-ray and tell us if there's anything that we might have missed, or maybe give the patient a visual of, so this is what AI is detecting on the image. And so it's kind of a second pair of eyes. It's like a second consultation when you run it through AI. So we have so many things that are available when we're using digital imaging. One thing that I also want to point out about digital imaging is the ability to make it more accessible. That's what this whole FDI Henry Schein collaboration is with the Integrated Health Records Project, is all about accessibility. And how can we provide our patients access to their images that they normally wouldn't have access to? Right now, the only way patients can get access to their images is they have to call us or message us through an online chat. Is they have to reach out to the practice and say, hey, I need my x-rays. I'm going to a specialist, or I'm moving to out of state. I need to take my x-rays with me. And now we have to figure out how to export your patient's images to another physician. Well, it's clunky. It's cumbersome. It's time consuming. It's a royal pain. It's a pain to get your images out to the patient or out to a specialist. Or if you get requested for records, maybe you're being subpoenaed for records, or you have to release records for some kind of an audit or something. It's just a pain to do it. Like all of the imaging softwares out there, they don't make it easy. And so the plan is to make it easier. Now, if everything lives inside of your Dentrix software, it will make it easier because we will have a patient portal. That is the plan. The plan is to have a patient portal where patients can log into their portal. They can download their x-rays. They can get a copy of their clinical notes. They can get a copy of their health history. That is the plan. The plan is we need to make patient information more accessible to the patient, to other doctors, to insurance companies. So we have to be able to make our patient's information more accessible. It's better for everybody. Now, some of you might be cringing like, oh my gosh, I don't want my patients being, to see their clinical note. Well, then you have to have better clinical notes. You need to document better if you're afraid of your patients seeing their clinical notes. So we need to change our mindset around patient information. Now, if you know anything personal about me, you know that I have a special needs daughter, and the only way, she lives in Seattle, I live in Denver. Okay. So I can't just walk into her doctor's office and be able to get her records. Okay. I have to be able to log into a portal and be able to get access to her records, whether it's for her Social Security documentation or whether I need to send information to another physician. So the UW Medical Center, the UW Medicine, their portal makes it easy for me as her mother to be able to access her information. I can read her clinical notes so I can see what happened during her last doctor visit. I can see her prescription information because it's all in the portal. We don't have that in dentistry. Okay. So we make it really hard for our patients to get access to their information. So if you're a doctor and you're afraid of your patients getting access to their information, well, then we need to talk because you need better documentation. You need to be able to have that information accessible to your patients, accessible to other physicians. And so that's why I'm here. I'm here to help you with better clinical documentation. And having imaging and other clinical diagnostic data available inside of your Dentrix software will make it more accessible to patients, more accessible to other physicians. And so another thing I want to point out is that as of Dentrix, every one of you has access to Dentrix Imaging Center. So Dentrix Imaging Center came out a couple of years ago. So I've trained on it as a solo piece of software. Offices used to have to pay extra for it, and get it downloaded into their software so that you could have imaging built natively inside of your Dentrix software. Now, Dentrix just gave it to you. You have Dentrix Imaging Center available now. If you go to your patient chart and you see a little icon on the toolbar, it looks like a little red flower, that is Dentrix Imaging Center. And it is phenomenal. It's easy to use. It is, clinically, the clarity and the diagnostic quality of the images is as good or better than any imaging software out there. And so I highly recommend that you start using it. It is included as in part of your customer care essentials customer support plan. So you have the ability to use it right now. This will help you to have a more streamlined system for streamlined workflow for attaching images to your insurance claims. If you're using Dentrix eClaims, it's super easy you just have to click on the button and it attaches the image to your claim instantly. You can export the image out very easily. You can import images very easily from another provider. It's so user-friendly. I'm just very happy with how they built the software because they didn't make it hard. They made it super easy. And so I would expect that the Henry Schein One team of developers are working on a patient portal. So imaging that's inside of your patient chart should be part of that patient portal. I would expect that. And so I hope that you start using Dentrix Imaging Center. Now, I also know that there will be conversions from other imaging softwares into Dentrix Imaging Center. I have several offices that are using CareStream imaging right now, and I know that Dentrix is already doing conversions from some of the most popular imaging softwares now into Dentrix Imaging Center. So if you want, you can reach out to me directly. I'll put my email address in the show notes. You can reach out to me directly and ask if your software is slated for a conversion. I can also find out if there's going to be a fee involved, what that might look like. So just to wrap up today's conversation, I have now wrapped up the 8 oral health indicators slated in the FDI Henry Schein consensus statement on integrated health records project. I know that's a mouthful. That's a lot. Okay. Imaging and diagnostic information is number 8. So we've wrapped that up. You can click in the show notes to download the consensus statement. You can also click back and rewatch all of the 8. And I am going to try and consolidate those all into a newsletter that I will put up in my LinkedIn profile. So you could also do that as well. I'm just trying to get the information out to as many people as possible. And my goal is to help you build it and get it integrated into your software. That's my goal. Okay. So I hope that this was helpful for you. If you liked this episode, please share it with your colleagues. There's a share button. Just send them the link to this episode. If you could do me a favor and rate and give it a review, 5-star review, it really helps get this podcast out to more people. All right, my friends, thank you for sharing part of your day with me. And I look forward to watching your journey of becoming a high-performing dental team.